Well, hello everyone. It's Dr. Amig, your friendly rheumatologist from Onabridge MD. Today, I want to talk to you about lupus or systemic lupus erythematosus. So, SLE. And we're going to talk about, I'm going to do this in a different part of this one. This first part is how do you make a diagnosis and what it is? So this is a very common question. A lot of patients come with a positive ANA and think they have lupus and suddenly freak out because they're like, oh my gosh, I have lupus just because of the ANA. The first thing that I wanted to let you know is that we don't make a diagnosis just based on a blood work, okay? So that's really important. In general, to make a diagnosis of lupus, you're gonna have to need some diagnostic, symptoms, so how you are looking, what you're complaining of, and then you're gonna put it in the context of blood work or sometimes biopsy, okay? So tissue. And it's really just the conjunction of those two that are gonna make the diagnosis. So that's really important. Blood work by itself will never make a diagnosis of lupus. What is lupus? So lupus is really an inflammatory condition that is autoimmune. So it's your own system basically attacking, not recognizing that it's your own, and basically attacking your own system. And because of the way it's working, because it's not recognizing you as you, and is basically recognizing something in you that needs to be repaired or gets gotten rid of, it's going to cause inflammation. And really, almost all of the organs can be involved. And so we're going to go a little bit into what are the organs that are involved so that you can understand how it presents. And then once you have, if you were to have those symptoms, then you basically look for a diagnosis with, you complete this with blood work, okay? So I'm going to start with joint pain because that's the most common complaint for rheumatologists, right? So you may have involvement of your joints, and that's what we call the inflammatory arthritis, joint pain. Usually it's the small joint. Very often, we don't really know why the elbows are involved in lupus, okay? So that's joint. You can have skin, all right? So skin, it's going to be the butterfly rash. So if you have this, it's usually associated with sun exposure. You may feel that you're allergic to the sun. It's going to be involvement like Raynaud's, so that's more of a vascular issue, but basically Raynaud's is when you go to the cold. So it's particularly abrupt change of temperature. So when you go from it's hot to air conditioning environment that's very cold, you may develop white, like basically half, part of those fingers become white. I do have Raynaud's. I don't have lupus. You can have Raynaud's without lupus. You can have joint pain without lupus. And so basically, this, if I were to go in the cold, I may develop like very abrupt change of colors in my fingers. That's Raynaud's. You can have alopecia. So alopecia, it's hair loss. And the hair loss in lupus is patchy. There's also the receding line. So you would see here that you're losing hair here, and then you're going to have bald spots, okay? That is a sign of potentially lupus. Again, all of those symptoms can be related to some other things. I'm just talking about what we're looking for when we're wondering if there is lupus. So we talked about the joint. We talked about the skin, including the alopecia, because that really is the skin. And we talked about vessel. With the Raynaud's, more vessel, you can actually have vasculitis. So vasculitis is inflammation of the vessel, and what it does is that it usually causes fever. It can cause skin rashes, so that's like a specific type of rash. You can have neurological involvement, so that's going to be like nerve pain. So if you have this sensation of nerve sensation, like either numbness or on the opposite, like burning sensation, electricity, that's nerve pain. You can have involvement of your lungs. Most of the time, it's fluid that goes into your lungs. And so what it's going to cause is that it's going to cause shortness of breath as well as pain when you're inspiring or breathing, in or out. Most of the time it's in. That's causing pain. usually at the bottom of the lungs, but mostly like the shortness of breath. You can have other involvement of your lungs. I'm not going to go deeply into this. Most of the time, the symptoms are basically just shortness of breath. You can have cough and so on. The shortness of breath can also be caused by heart involvement. So heart involvement, you can have inflammation of the lining of the heart. That's the pericarditis. So the pericardium that gets inflamed. And it's really just the same process than the pleura, which is the lining around the lung that gets inflamed and does pleuritis. So pleuritis, pericarditis, you can have involvement of the muscle of the heart, and that will cause heart failure. So shortness of breath is really what it is. I hope I'm not scaring you, because there are treatments for all of this, really. It's really just more for knowledge so that you are educated about all of this. And you can have involvement of your kidneys. And so this is actually what it's like sort of this silence, and it's silent. And unless you check blood work to check your kidneys, unless you check urine, you're not going to necessarily know that there is something going on with your kidneys. The couple of symptoms that you have to be aware is if you're seeing your lower extremities, so your ankle start becoming swollen, and you have something that's called pitting edema, where you press your finger in, there's an indentation that doesn't go away right away. That can be a sign of issues with your kidneys, where there's too much protein that are getting out of your kidneys. There can be hypertension. So if suddenly you develop hypertension, that's something that you want to look. There can be shortness of breath associated with renal failure as well. And really, anyone that's suspected to have lupus should have protein and urine analysis checked in the urine. So you always have to give urine. If you're not giving urine, your doctor is forgetting something, so just remind them. And it's okay, we're human, we're only human. Just say, hey, I've heard on Rheumatology 101 with Dr. Amig that I'm supposed to be checked for protein and anomaly, and blood and cells in my urine. Can we do the test? Okay. Those are the main one. There are, of course, many other symptoms. So there can be lymph nodes. So you can. I'm showing this because that's the easiest to access. So lymph nodes here, you can have them here. You can have them under the axillary. You can have them in the inguinal, and then of course you can have them in the whole body. There's lymph nodes everywhere. It's just the proof that something is going on in your immune system. And there can be fever, same thing, just to prove that something is going on with your immune system. You can have weight loss. I forgot to mention that you can have ulcers in your mouth and your nose. Usually they are not painful. So if you have ulcers, no sores, know that in the case of lupus, they are not painful. All right. And, so I'm looking at all the way from up to the bottom. You can have eye inflammation, that it does happen, but it's not as common, I would say. And I'm just going deeply down. You can have involvement of your gastrointestinal tract with diarrhea, blood in the stool. That is a possible sign of lupus, usually not isolated. That's why I don't spend too much attention to it. Usually, if you were to have this, is that there are, more things ongoing. And you can have many other symptoms, but I feel like those are the most common. If you have any of this, then what you want is to check blood work. And the way we would make the diagnosis is we would check to see if you have involvement of your kidneys. That's very important. So with a creatinine, as well as with urine analysis to see if you have protein or cells in your kidneys. And we would also check the serology. So we check usually the ANA, the dsDNA, the Smith antibody, as well as some other antibodies, but those are the main one, okay? If you have symptoms, some of the symptoms that I've told you, and you have a positive ANA, you have a positive dsDNA, you have positive Smith, you have a low C3, you have a low C4, the diagnosis is super easy, right? So it's easy. If you have one or the other, or you have some symptoms, but you have none of those antibodies, that's when we have to think about it. And we have to be okay, well, maybe it is not yet lupus. Maybe it's a undifferentiated connective tissue disorder, which is not a term that I like, but It just tells us that something is going on. We just don't have the diagnosis yet. And then the last thing, and that's really important, is that with research, we found that people may have a negative ANA, but they have a positive biopsy. And so we would do a biopsy of the kidney and we would see typical lupus nephritis, which is lupus-related inflammation of the kidney. And we are not going to wait until you have a positive ANA to treat you, okay? So if you were to have involvement, like a typical involvement of the tissue, and we see the tissue related to lupus, we are not needing a positive ANA. But in general, if you have all of those other symptoms, the joint pain, the alopecia, so the hair loss, the sore in your mouth or in your nose, and you have, maybe a chest, like inflammation of your chest, inflammation of your lungs, inflammation of your heart, you have to know that we would normally need a positive ANA to make a diagnosis of lupus, at least a positive ANA. You can have it, like if you have dsDNA or SMIF, that's an easier one, okay? So that's the first step. It's how to make a diagnosis and what is lupus. And I will see you in the next episode where we're going to talk about how we manage this and what we can do. And there's a lot of good stuff going on. So you don't have to fear. All right. If you need a rheumatologist in the Denver, Colorado area and you're fed up of insurance, you can look at my website. So it's onabridgemd.com. or contact us at info@onabridgemd.com. We are the first one to offer direct care or concierge practice in rheumatology. I love what I do. And if you think that you're a good fit, just contact us. Otherwise, I'll see you at the next episode. Take care. Bye-bye.